Welcome to Go Vote Omaha. This is a candidate forum for Legislative District 13 presented by the League of Women Voters of Greater Omaha. I'm Geri Simon, a League member and moderator for the forum. The League of Women Voters never supports or opposes political parties or candidates. We present this forum solely for voter education. Here's the format for our forum. Each candidate will have a 1-minute opening statement. We'll follow that with questions and answers. Each candidate will have up to 90 seconds to answer each question, and the person who answers the question first will have up to 30 seconds rebuttal. We'll alternate the speaking order throughout the forum. After the question and answer period, we'll conclude with a 1-minute closing statement. A timekeeper will alert the candidates when they are to stop speaking. Before our forum this evening, the candidates drew lots to determine their initial speaking order, and I'll introduce them to you in that order now. There are 2 candidates running for LD13 in the unicameral. They are Jill Brown and Justin Wayne. And now we'll begin with our opening statements, beginning with Jill Brown.
Okay, thank you so much, Geri. So hello, everybody in Omaha and LD13. I really want to thank the League of Women Voters very much for holding this forum. Since 1920, you've been helping spread democracy in America. So my name's Jill Brown. I'm an associate professor of psychology. I teach at Creighton University. I spend most of my time in the classroom teaching and also doing research. I'm a lifelong Nebraska, grew up in rural Nebraska, but have been in Omaha about 16 years. But my work has taken me other places. I was a Peace Corps volunteer in Southern Africa. I received a Fulbright Fellowship to study in India, where I looked at women's economic development and the implications of culture. And I'm running for legislature, quite honestly, because I want to give back to a state that's given me so much. I really believe, I study child development, and I believe that the heart of democracy is found inside of our own heart. And we ask the same questions children ask. Can I be fair? Can I be equitable? Can I really listen? My experiences poise me to be a good legislator and to fight for social justice in our district and in our state.
Thank you. Justin Wayne.
Again, thank you, League of Women Voters of Omaha. Thank you, Dr. Brown, for participating in this event. And I also want to thank the voters of District 13. In 2013, you entrusted your vote with me on the Omaha Public School Board, and I am honored, and it's been a pleasure to serve as your school board representative and increasing education achievement for all students and some of the wonderful things we've been able to do. So I thank you for that. As a lifelong resident of District 13, a youth volunteer, a small business owner, and an attorney, I understand the importance of investing in our children, education, businesses, particularly small businesses, and the community. With your support, we'll be able to go to Lincoln and end politics as usual by passing legislation that will help grow our economy, increase funding and accountability to our school systems, and make sure that we have a great state as we move forward. Thank you.
We'll get right to our first question. What should be done to support reform in our prison system? Can we afford to add staff or to prevent overcrowding in the system? And we'll begin with Justin Wayne.
The first thing we have to do is look at the criminal mind, in the sense of we have over 75% of our population that is in prison have mental illnesses and mental health disease. We have to make sure we treat that. We also have a large percentage of prison population who have substance abuse. So it's not just about increasing the number of guards and prison staff. It's about how do we take care of the holistic approach. As a criminal defense attorney and juvenile attorney, I have a lot of experience in this area, particularly working with the juvenile justice system to make sure we stop the prison pipeline. And once somebody gets in the juvenile system, they tend to stay in there and have a reopened door, a revolving door that just continues throughout the rest of their life. So we have to start to restructure our juvenile code, which I believe I have a great experience as being a practitioner in that area. Then we also have to make sure we deal with some of the mental illnesses and mental health issues and the substance abuse problems. If we stop criminalizing some of these things, our overpopulation will decrease. In addition to that, we have to make sure there's adequate staffing. Right now, we don't have adequate staffing because I know Terry, who is in our district, voter of ours, who left the prison system as a prison staff, as a caseworker, and took a job working at a local grocery store. The reason he did that is because the money and pay was that much better as a manager of our local grocery store. We have to make sure we're paying living wage jobs, but not just living wage jobs, but jobs for the risk and the things that they have to deal with while they're working in the prison system.
Thank you. Jill Brown.
Well, Jerry, I don't think we have a choice. I think that this problem is upon us and we need to have reform within our prisons. We do need to address mental illness. You know, I don't know if it's 75% of everyone in the prison system is mentally ill, maybe including substance abuse, but it's a huge percentage. Mental health needs to be dealt with on a state level also, and I think that will be reflected then in the prison system. But you know, one statistic, we have the highest incarceration rate in the industrialized world, and African Americans are they're in the system more than they were in slavery in 1860. This is a disgrace. We need to really think about why people are going to prison, stop the school to prison pipeline, and really work on this. Some things I would suggest is changes in sentencing for nonviolent crimes. And also we do need to look at paying people higher wages, not having them do mandatory overtime, and really treating these public employees, giving them the respect that they deserve. That's what I would suggest.
Thank you. Any rebuttal, Mr. Wayne?
No rebuttal.
Okay. Our next question is, what do you propose about Medicaid expansion? Would it help offset the budget shortfall? And how do we provide health care for all Nebraskans? And we'll begin with Jill Brown.
Well, I absolutely support Medicaid expansion, and let me tell you the reasons why. I think that healthcare is a right. Shouldn't be something that's the role of an economic dice, like many of us have felt. This is a personal experience for me because I've had a brother that hasn't had healthcare, and since the ACA he has, and he's gotten better, he's had preventative care, he's done a lot of those things. And I know that ACA has problems, but Medicaid expansion is gonna help our state. I think it will help financially. You know, some of the rural hospitals are very much in trouble because of lack of patients and because of reimbursement issues. This money is already in the state. We need to take advantage of it. It's a social issue, it's a social justice issue, but it's also very much an economic issue that makes sense.
Thank you. Justin Wayne.
I agree. I am support of expanding Medicaid, and primarily it's because of three people that I just met last week. One is a voter in our district who has worked her whole life in the telecom industry and was laid off, and now she's what we would deem as a working poor. And we throw out these names, but they're real people, and her name is Samantha. And she works 32 hours a week and can't afford, and her job doesn't offer health care. This would help her. There are actually like other 3,000 people in our district that would also qualify if we expanded Medicaid. So people we consider the working poor would benefit. There's mental illness that we can able to expand and make sure that they're treated, and substance abuse programs that we can expand and make sure people are treated. So I can go through each voter that I've talked to who think this is a big issue. And the reason it's an issue is because we're all affected. Whether you're in Western Nebraska or whether you're in District 13, we know somebody who can benefit for expanded Medicaid. So I'm in favor of it. I don't think you'll see a disagreement between these two candidates up here. We know it's an important issue. The state would be able to receive $2 to $3 billion over the next 10 to 20 years if we're able to do this. So I'm in favor of it. I don't have a long speech because I think it's just something we got to get done.
Thank you. Anything additional, Ms. Brown?
Yeah, I would like to say that, you know, the projections have even increased that around 80,000 to 87,000 people could be covered under this. And so this is an economic issue. And if it doesn't speak to your heart on any other level, right, it should speak to your heart that this will help with the budget shortfall. This will help with helping the economics of our state.
Thank you. Here's our next question. Do you support advancing a proposal for charter schools in Nebraska? Do you support use of school vouchers or scholarships that really are the same thing as vouchers? And we'll begin with Justin Wayne.
The answer is I think every child, no matter where they live, should have a high quality school in their neighborhood. And I believe in public options. So no, I'm not looking to propose any charter schools or support any charter schools. What I'm looking to propose is public options. For example, in Omaha Public Schools, we have a dual language program that statistically closes the achievement gap. It is offered in Western Omaha, it is offered in South Omaha and downtown, but it's not offered in North Omaha. And we need to be able to provide those public options to our students and to our families. Rather, what we're doing is busing kids for over an hour each direction to make sure they have that choice. That public choice should be able to be available within the district and within the neighborhood that they live in. That's why I'm a big proponent of making sure that there's public choice. We have been working on this for Omaha Public Schools. We are looking to do more, but I also think we have to keep the partnership open with the homeschool and private schools. And what I mean by that is we have to all work together. OPS just launched the online school that allows homeschool students to access some of the career and curriculums that we are offering in Omaha Public Schools. It's that kind of public partnership that makes Nebraska great and makes our education system great.
Thank you. Jill Brown.
Well, I support public education, and I don't support charter schools. I don't support the privatization of public funds for charter schools. And I guess I'm a little confused because in a forum earlier with Mr. Wayne, he did support charter schools, so maybe he's had a change of heart. But here's why I don't, is I feel like public education needs to support all students, and charters don't. Charters have, because they're privately run, they have the ability to not take students with disabilities. That's not what's best for our public. Also, if you look at the research between charter and public schools, there's some good charters out there, but if you look at matched studies, they're not better than public schools. And 13 charter schools in Florida closed last year. There are big problems with privatization of public education. I really don't think it's a good idea for Nebraska. I know we're one of 7 states that don't have charter schools, but I agree with Justin that we do need to provide a good education for our students, and they need to be public school based, provide more options, allow teachers really to innovate and principals to innovate and to allow other options. Bring in other curriculum. Let that be community-driven and community-based, but not take public funds and give them to privatization of education.
Thank you. Any rebuttal, Mr. Wayne?
Yes, the rebuttal is I've always been consistent in the fact that I support school choice. School choice and charter schools are 2 different things. School choice is the ability to go to a dual language program or to go to Howard Kennedy, which is a specialized program, go to Wilson Focus School, which is a year-round program in Omaha Public Schools. I have been pressuring Omaha Public Schools to provide more choice, and I will continue to do so as your legislator.
Thank you. Here's our next question. Should voting for positions within the unicameral continue to be by secret ballot? Why or why not? We'll begin with Jill Brown.
I do believe that they should be. I do believe that they should be. I think it's important for legislators when they're asked to make these considerations to be able to vote privately. I think there's a lot of pressure. There's a lot of pressure from outside and inside the unicameral, and I would support having senators still have a private vote.
Thank you. Justin Wayne.
I disagree with this. I think it should be a public vote. It's no different than campaign finance reform. I think we need to do more to show transparency and accountability. You are elected, and any vote you take in that elected position should be public, should be transparent, and voters should be able to hold them accountable on that vote.
Thank you. Any rebuttal, Ms. Brown?
Yes, I do think that there should be transparency, and if anybody asks my vote, I would tell them it would be public in that way. I just also believe that as a body working together, that this creates a good environment, that allowing people to have a private vote creates a better environment.
Thank you. Here's our next question. What is your position on medical cannabis or marijuana use in Nebraska? Will you support a bill to make it legal in the next session of the unicameral? And we'll begin with Justin Wayne.
I do support the use of medical marijuana in the form of oils. I know somebody, a personal friend of mine who has moved to Colorado, Michelle, and she was a voter of District 13 and moved. And the reason she moved was because of her daughter was having seizures. And those seizures have resided, and now that child is going to public school in Colorado and doing very well. I think it's critical that we don't put people in pain and suffering because we want to block the stigmatism as an elected body. I think it's important we legalize cannabis oils and make sure people can have the treatment. I also met a voter, Sherry, who was in District 13, who uses CBDs, cannabis oils, to help with their arthritis. I think that's fine. I'm not for the legalization of recreational marijuana, but I think there's enough evidence and enough support that legalizing medical marijuana in the form of oils is critical to helping making sure that Nebraskans are healthy.
Thank you. Jill Brown.
Well, I absolutely agree that there is scientific evidence that links the use of medical marijuana with a lot of disorders. So neurological disorders, glaucoma, pain reduction, appetite stimulation. There's really well-documented evidence to show that. But then if you look at states that do have legalization of medical marijuana, almost entirely the prescriptions are not written for those disorders. So I agree that we need to be giving care to people and giving relief to people that need relief. And if that works, that's what needs to happen. I just don't think the bill that was put forward in the last legislative session is the best way to approach it. A better way, Minnesota right now is looking at a more comprehensive way to protect the healthcare providers and to protect patients. So they have much more detailed clinical assessments to get the prescription for medical marijuana. I think if something like that is proposed in Nebraska, I'd absolutely support it. I don't think it should be a backdoor way to having legalization of marijuana, though. It should be two separate issues.
Thank you. Any rebuttal, Mr. Wayne?
The issue between a parent, or patient and doctor is that should remain confidential, and I don't want to regulate that in any sense. And in fact, most of the bills that I've seen introduced over the years were based off of the Minnesota law. And those are the kind of laws that I think we need to look at, and we need to find ways to make sure people who need the medical treatment can get those medical treatment.
Thank you. We'll start this next question with Jill Brown, and it is, if elected, what are your priorities for your district, and do you have any legislation you plan to introduce?
Well, my priorities really do involve, we all share an economy. We really need to have sound economic development. That's one priority. Another priority is to invest in education and to invest in early childhood education. We have an achievement gap in OPS. We have an achievement gap across the state in populations, but poor children have been performing on the same level throughout history. That's not different. The problem is we have more poverty. That's why that this is an alarming statistic. So one initiative I really want to work on is increased early education, early childhood education. I think we should do everything we can. Those 50,000 hours between conception and when kids hit kindergarten, that's when the achievement gap happens. So we should be putting resources into making sure that that environment is as nurturing as possible, is less stressful, less traumatic. Right now I'm actually involved in a research study with my colleagues at Creighton where we're introducing an intervention for PTSD. 1 in 4 kids in one of the zip codes in North Omaha has been diagnosed with PTSD. So these are ways that we can really help with early childhood education, and that'll trickle down into helping economics.
Thank you. Justin Wayne.
I agree with the priorities. The first thing I want to do is introduce economic development. And how I've been looking at this is one area is renewable energy. I toured Steel Flats not too long ago, which is down by Beatrice, to understand how the wind development actually works. And Nebraska is number 3 in the country when it comes to wind capacity. And so one of the proposed legislations I want is to make sure that we double our wind output over the next 4 to 6 years. And we have the ability to do that. There was a legislative interim study that showed that we can do that, and it's time for us to be bold and make sure we create enough jobs in Nebraska that we can start eliminating some of this poverty. The second thing is education. I think we have to increase funding in education. I've been on the school board and I've been working with state legislatures for the last 4 years, working on how to make sure we increase funding to poverty students and students who need the most. Last thing I'll tell you that I want to do is invest in or pass legislation about safe and secure neighborhoods. I'm proud to be not only endorsed by our police, but I'm proud to be endorsed by our teachers, because it's both of them that are helping me come up with this legislation to make sure that we have increased funding and safe and secure neighborhoods.
Thank you. Any rebuttal?
So one other of my priorities that I didn't get to mention, because I talk about childhood a lot, would also be healthcare and making sure that we have mental health care. The new managed program system of Heritage allows really to group mental health with physical health in a way that really takes care of the person in a more holistic manner. I would be bold and fight for increasing funding of mental health care. We have to put our money where our mouth is with that, because it is affecting our entire society.
Thank you. This will be our last question, and we'll begin with Justin Wayne. What is appropriate funding for community-based behavioral services?
To take that question into just that context, I couldn't tell you. We have to increase it. I think for every dollar we invest in our community health centers, there's tenfold that we get back from society. But there's also a lot of other things we have to fund. So we're looking at our budget. We have to make sure we balance all those. But I think community-based health centers are at the high of my priority list, including education. And we have to make sure that we provide the needs of mental health. We have to make sure we provide the needs of physical health, because that overall increases our economy. People are healthy, they can go to work. And without that community health center, we're leaving a lot of people, and Medicaid expansion, because I think that's a part of this conversation. The primary doctors for those people who are in that gap coverage is firefighters often, or emergency rooms. And that's not an efficient way for us to govern, and that's not an efficient way for us to live. So we have to make sure we increase funding to community-based health centers, but we also do it in a way that we make sure we don't hurt education. And what we've been able to do at OPS is we've been able to put community-based health centers into our schools to make sure children and their families have access to low-cost, high-quality health care. And we've been able to do that over the last 5 years. And I'm proud to be a part of that, because we've seen attendance rates go down as far as absenteeism, and we see engagement with parents go up. That type of service is what we can do without even raising any taxes to the taxpayers. And we were able to do that in OPS, and I think I can take that leadership down to Lincoln and do the same thing.
Thank you. Jill Brown.
I think the question was about behavioral health.
Yes, what is the
Okay.
appropriate funding for community-based behavioral services?
Okay. Well, increase is the appropriate answer to that, is that we need these services. So also we should look at this, the behavioral system, the region system statewide is an antiquated system that was developed really kind of in a frontier model. I think we should look statewide whether that's the most appropriate system to deliver these. On a community level, we have to invest more. We absolutely have to invest more in behavioral health. If we don't, right, here's some issues with behavioral health. People are not reimbursed on the right level, and so people aren't going into the profession. We need to invest in skills training, and in a similar way that physicians can get tuition reimbursement for going into the medical field, we need to do the same thing for mental health workers and place them out into the community where they're really going to help. I think the touch point of the school is a brilliant idea, and it's a way to really work at that. I know we've social workers, increasing funding for social workers in schools is going to be very important in the future. It's going to be able to deal with that bridge between home and school school is a touch point for that.
Thank you. Anything further, Mr.
No.
Wayne? Okay, thank you. Well, it's time for closing statements, and we'll begin with Jill Brown.
Okay. Well, thank you so much for this opportunity to share some of my ideas, and thanks again to the League of Women Voters and Mr. Wayne. I think you will make an informed decision about your next state senator. I really think we need more accurate representation in our legislature. There's only 9 women in the legislature right now. 50% of our population is women. I'm really asking for your support. I have the support of the current Senator Tanya Cook, and I've had many conversations with her about what it means to really serve with integrity. But more importantly, I want to tell you what I can give you. I will have an open door, and I will listen. Some of my training as a psychologist, as a teacher, I really know that I can do this job, and I can do it well, and I can really serve you. So thank you for your support.
Thank you. Justin Wayne.
Many of the issues that we're facing in District 13, whether it's healthcare, education, economic development, or the juvenile justice criminal system, are areas that I'm actually in every day. Every day I'm working with kids, every day I'm growing a small company, every day I serve as an OPS school board member, and every day we are providing healthcare to many of our students that are in need. I led in this area. I worked down in Lincoln multiple times with bipartisan support, working with the legislature to make sure we close the achievement gap, make sure we produce more jobs in Omaha, particularly District 13, and make sure that we grow our economy. And that's the biggest thing that I'm running about. I'm running for. We have to grow our economy. And I believe I have the leadership ability to do that. And if you look at the record that I had on Omaha Public School Board, we've been able to accomplish great things in the last 3 years, thanks to my leadership and thanks to the leadership of the board. It's about building a team, it's about building a coalition. And we've been able to do that. And part of it is having tough conversations and making sure we can do all the things that we need to do to make this district great. Thank you for your time.
Thank you. Well, this concludes our forum for Legislative District 13. The League of Women Voters would like to thank both our candidates for participating this evening. We'd also like to remind you that we have some other upcoming forums. On September 8th, we have a forum on the death penalty, which will be at 7 p.m. at the Community Engagement Center at UNO. And then we will be broadcasting legislative district forums on September 13th. We'll have LD31, September 20th, LD39. We'll have another live forum on Monday, September 26th, and that will be for the Omaha Public School Board. And on September 27th, we'll have Douglas County Commission District 3. We also will be doing, in conjunction with the Omaha Press Club, we'll be doing a forum for the Congressional District, the 2nd Congressional District. That will be at noon on October 14th at the Press Club. The League of Women Voters reminds our viewers that we never endorse or oppose political parties or candidates, but we do study issues and we take action and positions on those issues. And we also would like to show our contact information. If you have any suggestions for our show, Go Vote Omaha, you can contact the League of Women Voters at omahalwv@gmail.com or govoteomaha@gmail.com. So for the League of Women Voters, I'm Geri Simon, reminding you to inform yourself about the issues and the candidates, and on Tuesday, November 8th, Go Vote Omaha.